Hi, my name's Erica. I'm an RN and nurse practitioner student. Today I will be conducting a complete head-to-toe physical examination on a healthy 26-year-old female. Prior to entering the exam room, vital signs were obtained and are within normal limits. Also checked the patient's height and weight and calculated the BMI, which were also normal. Went ahead and checked cranial nerve number 2, which is the optic nerve. Tested visual acuity using the Snellen eye chart. Patient does have 20/20 vision in both eyes, not corrected with eyeglasses or contact lenses. Can you tell me your name?
Kiera,
Your birthday?
2/17/93.
And what city are we in?
Lafayette,
And what's the day of the week?
Saturday.
Okay, patient is awake, alert, and oriented. Speech is clear and coherent. Now I'm going to start the physical examination first by inspecting the patient's head and neck. I'm going to begin by inspecting and palpating the patient's head and skull, as well as her scalp. I'm going to palpate for any deformities, any lesions, lumps, bumps. I'm going to check the distribution of her hair, which is normal. I'm going to assess her skull for any scaliness or flaking, which there is none. I'm going to assess the patient's face. The eyes and the ears appear symmetric. The nose is midline. The lips are pink and moist. The sclera is white. Conjunctiva is pink and moist. I'm going to palpate her sinuses. First, I'm going to do the frontal sinus and the maxillary sinus. Any pain?
No.
Now I'm going to check for cranial nerve number 7, which is the facial nerve. Can you smile for me? Frown. Raise your eyebrows and puff out your cheeks. Cranial nerve 7 is intact. Now I'm going to check for cranial nerve number 5, which is the trigeminal nerve. I'm going to check this by palpating the patient's temporal and masseter muscles while the patient clenches her jaw. Open your mouth and move your jaw side to side. Any pain?
No.
Okay. I'm going to have you close your eyes. I'm going to touch different parts of your face. Can you tell me if it is soft, dull, or sharp?
Soft. Soft. Soft.
Okay. Cranial nerve number 5 is intact. I'm now going to continue to assess cranial nerve number 2, which is the optic nerve, by checking the patient's peripheral vision using the wiggle test. Can you tell me whenever you see my fingers?
I can see him.
And again.
I can see him.
Cranial nerve number 2 is intact. I'm now going to continue to assess cranial nerve number 3, 4, and 6, which is oculomotor, trochlear, and abducens. I'm going to check the patient's pupils. The patient's pupils appear round and symmetric. And now I'm going to check the pupillary reaction to light. Pupils constrict both directly and consensually. I'm going to check for accommodation and convergence. Can you look at this pen light? And check, look in the distance and follow it with your eyes as you touch the bridge of your nose. Pupils are equal, round, equal, and reactive to light and accommodation. Now I'm going to check the extraocular muscle by sweeping through the 6 cardinal fields of gaze. Can you follow this pen light with just your eyes? Okay, now I'm going to check for the red reflex. Red reflex is present. I do see an orange glow in the patient's pupil. We're now going to check for cranial nerve number 1, which is the olfactory nerve. Can you close your eyes for me and tell me what you smell?
Alcohol.
Perfect. Now going to inspect the patient's nares. The nasal mucosa is moist and pink. There's no polyps, no septal deviation, and no bogginess noted. Now I'm going to assess the patient's mouth. Can you open wide for me? Oral mucosa is pink and moist. Dentition is normal, no missing or broken teeth. And can you pick up your tongue for me? and the frenulum is midline and intact. Now I'm going to check cranial nerve number 9 and cranial nerve number 10, which is glossopharyngeal and vagus nerve. Okay, can you open your mouth for me? Say ah. Soft palate did rise. The uvula is midline. Posterior pharynx is pink and moist. No ulcerations, lesions, or erythema. Tonsils are grade 0, not visible. Okay, now I'm going to check for the gag reflex. Okay, open your mouth for me. Stick out your tongue. Wiggle it side to side. Perfect. Cranial nerve number 12, which is the hypoglossal nerve, is intact. Now I'm going to inspect the patient's neck. Now I'm going to inspect the patient's ear. I'm going to inspect the auricle for any erythema. Check for any tenderness by performing the tug test. Is there any tenderness?
No.
Okay, I'm going to extend the ear canal by extending the auricle up and back. Going to inspect the ear canal for any erythema, swelling, or drainage, which there is none. Tympanic membrane is shiny, translucent, and pearly gray. Cone of light is present at 5 o'clock, and bony prominences are intact. We're now going to check cranial nerve number 8, which is acoustic nerve. This will check for the patient's hearing. I'm going to first check the Weber test. I'm going to put this tuning fork on top of your head. Tell me which ear you hear the vibration.
Both.
Great. Now we're going to do the same. I'm going to ask you to raise your hand when you stop hearing the vibration as I put it behind your ear, and then again whenever you stop hearing the vibration when I put it in front of your ear. Air conduction is greater than bone conduction. There's no conductive or sensory neural hearing loss. Cranial nerve is intact. Now I'm going to inspect the patient's neck for any lumps, bumps, lesions, discoloration. The trachea appears midline. The thyroid gland does not appear swollen. Does not appear to have any nodules. I'm going to palpate the carotid pulse, which is +2 and no thrills. Now I'm going to check for cranial nerve number 11, which is the spinal accessory nerve. Can you shrug your shoulders for me? Okay. And push your head against my hand. Great. Okay. Now I'm going to palpate the thyroid gland, which is right under the cricoid process, the cricoid cartilage. I'm going to move it laterally side to side, noting any swelling, lesions, or nodules. Can you swallow for me? Okay, perfect. Now I'm going to continue to assess the patient's chest. I'm going to inspect the chest for any discoloration, any rashes, lesions. I'm going to look at the shape of the chest, the movement of the chest wall, looking for any abnormal retractions. The chest does appear symmetric with normal rate and depth of respirations. Appears to be a no respiratory distress. Now I'm going to check for tactile fremitus. I'm going to have you say 99 as I put my hand on your chest.
99, 99, 99.
Okay, vibrations are normal. I'm now going to check for chest expansion. Take a deep breath for me. Okay, expansion is normal. I'm now going to percuss the patient's lung fields. Resonance is noted. I would do that both anteriorly and posteriorly. I'm now going to listen to the patient's lung fields. a deep breath for me. Lung fields are equal and clear. No adventitious sounds noted. I'm now going to check heart tones. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid valve, and mitral valve. S1 and S2 is present. No murmurs or no additional heart sounds noted. I'm now going to continue the assessment by assessing the abdomen. Can you come lay right here for me? I'm going to inspect the abdomen, looking for any bulges, any discoloration of the skin, any lesions or rashes. And now I'm going to auscultate in all 4 quadrants. Bowel sounds are normal active in all 4 quadrants. Now I'm going to palpate the patient's abdomen, starting with light palpation. And now deep palpation. Any pain? No. No signs of rigidity, no rebound tenderness, and no guarding noted. I'm now going to assess for any inflammation of the gallbladder by testing the Murphy sign. I'm going to hook my finger under the right costal margin. Take a deep breath for me. Any pain? No. No evidence of inflammation of the gallbladder. I'm now going to check for any inflammation of the appendix by doing the Rauxing sign. Let me know if you have any pain whenever I press on the left lower quadrant, if you feel it in the right lower quadrant.
No.
Okay. Negative signs of any inflammation of appendicitis. You come have a seat for me right there. I'm now going to inspect the patient's upper extremities. I'm going to start with the skin, looking for any discoloration, any lesions, rashes, or edema, which there is none noted. I'm going to check her hands, fingers, and nails. Capillary refill less than 3 seconds, no clubbing noted. I'm going to check the radial pulse, which is +2 in normal. The brachial pulse, which is +2 in normal. I'm going to check the brachioradialis reflex. All right, +2 in normal. Now I'm going to have you perform range of motion for me. Can you put your arms out by your side and up above your head? Good job. Now I'm going to test for coordination. Can you put your hands on your thigh and flop them back and forth as fast as you can? Okay, great job. Coordination is normal. I'm going to check the strength of your hands. You squeeze my hands? Good job. Now I'm going to check for stereognosis, which is testing the sensation of the patient's hands. Can you close your eyes for me? And let me see your hand. Tell me what you feel.
Key.
Okay. Now I'm going to check for number identification. I'm going to write a number in your palm. You tell me what number that is.
3.
Okay, good job. Now I'm going to assess the patient's lower extremities, especially the skin, for any lesions, ulcerations. I'm going to check the temperature of the skin, capillary refill for toes, which is less than 3 seconds. I'm going to check her popliteal pulse, dorsalis pedis pulse, and posterior tibial pulse. All are +2 in normal. I'm going to check the reflexes in her lower extremity. I'm going to check the patella reflex. Now I'm going to check the Achilles tendon reflex. Good job. Those are both normal strength. Now I'm going to have you push up against my hands to check for dorsiflexion and down against my hands to check for plantar flexion. Okay? Now we're going to check the patient's stance. Can you stand up for me? Okay. Put put your feet together, arms by your side, close your eyes. Okay, this is a negative Romberg sign. I'm going to have you hold your arms out with your palms up. Okay, no pronator drift noted. Now I'm going to assess your gait. Can you come right here for me? Can you take a few steps forward, walking on your toes? And a few steps back, walking on your heels. Okay, can you take a few steps forward, heel to toe? Okay, now we're going to check range of motion of the hip. Can you flex forward for me? Okay. Extend back. Okay. Can you bend side to side? Okay, and can you twist at the hips? Great. Range of motion is intact, and this completes our physical examination.